Hello everybody, it's Kenneth back with another video. In today's video, I want to talk about some basics of cancers and some screening methods for some common cancers that you're likely to see if you go into the medical field or if you're just doing research. So I didn't make this presentation. If you want to see who developed it, you can pause and read that for a bit. So, first, early cancer may not have any symptoms. And that's true, right? Some people visit the doctor when they feel pain or notice a change in their body, but cancer can be present before then, which is why it's important to get screening because by the time there's pain, your cancer may already be at a stage where it's harder to treat than if you had come in and got screening previously. So just make sure you do your regular screenings as instructed, especially as you get older, because age is a very important factor in a lot of cancers. So, like I said, detecting cancer early can affect the outcome of the disease for some cancers, of course. And when cancer is found, doctors determine what type of cancer it is, how fast it's growing. And your doctor will also talk about whether cancer cells have metastasized or spread to other healthy tissues, which is actually how most cancers are deadly. The cancer itself isn't really the major issue for mortality most of the time. It's whether it metastasized or not. Um, and finding cancer early may decrease a person's risk of dying from cancer because if you find it early, it's less likely to have metastasized and it's also just less likely to have grown as much, so you can treat it easier. Now, we are going to be getting into some cervical cancer screening and other cancer screenings. So first, one screening technique for cervical cancer is a pap smear. And this allows for detection of cancer in the cervix since it is cervical cancer. And so a doctor will typically use like a small brush or a scraper to remove a sample of cells from the cervix and like the upper vaginal area. And then these cells are placed on a slide and sent to the laboratory where they're checked for like abnormalities. Again, you can see in the picture that it shows some abnormal cancer cells. Um, and this type of screening, it helps a lot. I mean, any screening for any cancer is very useful, and you should be getting them done if the cancer applies to you. And if they are found, or if a cancer specifically for this screening is found, or irregular cells are found, then additional tests may be performed. And actually, a main cause of cervical cancer is having HPV, which is a sexually transmitted disease. And there are 13, might be more now, but there are 13 types of HPVs that are recognized as a cause of cervical cancer, just if you're interested. So yeah, especially if you have HPV or you're frequently sexually active, then getting the screening is very important. So next is breast cancer screening, and for this, the doctor will be using a mammogram, which is like an X-ray of the breast. You can sort of see that here, and it's very beneficial for women as they age and undergo menopause, and that's just when like this cancer is most common. And it can detect like the other ones. It can detect abnormal tissues, but it's not definitively accurate. It's just useful to see um, if breast cancer is there. It's a very good starting point, and if there is like a presence of an abnormality, then of course further tests should be done. Now for prostate and ovarian cancer, so there are sort of two prostate screening ways. There's a PSA test, which is a blood test. Um, so the doctors draw blood and they test for PSA levels. I think it's prostate specific antigen levels in the blood. And then If those are abnormal, that could indicate prostate cancer. And then there's also the digital test, which is, where the doctor like checks out physically. Um, and this is useful for men like over the age of 50 and older because that's when prostate cancer is most common. And these together are used to just help diagnosis. But however, it is important to note that most men with an elevated PSA level turn out not to have the cancer. Like it's about a quarter of men that have an elevated level actually do have cancer. Um, so that's just important to note. Um, and then there are other blood tests for like ovarian cancer as well. And there are some that are under development too. Might not be anymore. The slideshow is a little old. For colon cancer, there's two things you can do. I believe the fecal occult blood test is more like recently created. And like you can see on the screen, the one on the right, the colonoscopy, that's probably what most people are familiar with. But the fecal occult blood test, it detects like blood in the feces, and it's like invisible amounts. You can't see it with the eye. Which it doesn't necessarily just indicate colon cancer. It can indicate other disorders, but colon cancer is among those, so it's important. And this can be done at home. You just take a sample of your feces and you smear it on like a card, and it's then tested in a laboratory. Like you ship the sample back, and they test it in the laboratory for blood. And then if blood is confirmed, then more elaborate tests may be conducted to find the source. And then there's the colonoscopy, which uses a colonoscope to find growths throughout the colon, which are known as polyps. And doctors will biopsy the polyps to like take them and test them or look at them to see their pathology, see if they look like cancer cells. And then there's a sigmoidoscope, which is similar. It's just in the lower colon and rectum area instead of the colonoscopy, which is throughout like the whole colon. Both are useful. Both are good. So there's let's talk about biopsies. Okay. So to diagnose cancer, a doctor has to look at a sample of the tissue, which is where a biopsy comes in. So when screenings that don't already do this indicate possible cancers, a doctor then removes they perform a biopsy where they remove some of the tissue from like the area, and then they examine it under a microscope. It's important to note that like for leukemias, a blood sample would serve the same purpose because leukemias it's like a white blood cell cancer. So this examination, like the doctor can tell through the examination if a tumor is present and whether it's cancer or not, so malignant or benign. Microarrays can also be used to determine which genes are turned on and off. And we may make a separate video on microarrays because they're very interesting, but I won't go into depth in that here. And proteomic profiles may be collected for an analysis of protein activity in the cells. And this information just helps doctors make a more accurate diagnosis. Now, cancer cells, how do you tell under a microscope like how they look different? Well, normal cells, they're really uniform. They have one nucleus. Well, most cells have one. Anyways, they're uniform. They look like kind of, I don't know. Well, what I expect a cancer cell or what I expect a normal cell to look like is like in a pattern, uniform, kind of like the same shape. They're kind of like the person who works a 9-to-5 job. They're basic. They're doing the same things, but they're doing what they're supposed to be doing, right? So in normal, there's like regularly dividing cells, and they have one nuclei, relatively circular, same shape. And you can read on the screen these here. There's no variations in cell shapes or sizes, and they have their specialized features, and they're organized, right? And for cancer cells, it's going to be the opposite. There's going to be many dividing cells, so it'll be like a clump, and that's like why tumors, they grow so much, and then they'll be like weirdly shaped, weird nuclei, potentially even more than one nuclei. Their sizes will be all over the place. They won't have special features because they're not performing any useful functions, and they'll just be disorganized and just all over. Think of it as like a mess. Someone who, I don't know, is unemployed and parties all night. They're a mess, you know. Now there's these two things called hyperplasia and dysplasia. Hyperplasia is when there's like extra cell growth. So there's extra cells being produced that aren't necessarily normal. It's not that the cells aren't normal, it's just that there's excess cells. And this doesn't necessarily indicate cancer, because I know on the last slide it says that a large number of cells, but these cells, they're not like irregularly shaped. They're not necessarily cancerous. So this can be like a sign or something to look at, but this doesn't indicate cancer. So it's important to note that, right? These are kind of like calluses, right? Calluses on your hands from doing activities. You build up the skin, gets rougher. Now, dysplasia can be associated with cancer. You could kind of see on the images like the difference. Hyperplasia, there's a lot of cells, but dysplasia, not only is there a lot of cells, they're irregularly shaped and they're strange, which, as we talked about, are signs of cancer. And yeah, so this is like abnormal, loss of tissue arrangement and cell structure, and many times the cells go back to normal, but they can become malignant or cancerous. So these should be monitored closely by your health professional if they are present. Now, this is a severe case of dysplasia, right? As it says, severe dysplasia is carcinoma in situ, which means carcinoma in place. And basically, it's an uncontrolled growth of cells that remains in the same location, original location. But it can develop into an invasive malignant cancer and can become metastatic or move around to healthy cells. So it should be removed if possible. Now, tumors, basically what this is saying is that cancers with highly abnormal cell appearance and large numbers of dividing cells tend to grow more quickly. Makes sense. They spread more frequently. They are less responsive to therapy. They're just worse. So doctors assign a grade to most cancers, and a low grade, like grade 1 or 2, refers to cancers with fewer abnormalities than those with a higher grade. So think of it like stage 1 cancer, stage 2 cancer instead of grade, right? Low grade cancers, you're more likely to survive than higher grade cancers. This is like the same thing as stage, right? These are stages. So to determine how far a cancer has progressed, doctors typically ask, like, how large is the tumor? How much has it invaded surrounding tissue? Has it spread to the lymph nodes, or has it spread to other parts of the body? And based on the answers, this is where the stage is actually assigned for cancers. And of course, at a lower stage, you're more likely to have a higher survival rate. That's really it for this presentation. Thank you guys so much for listening. If this helped, please like and subscribe. Otherwise, give us some feedback if you'd like to. Thank you.